Hello everybody, this is Dr. Kalpana Sringar from Prakruthi Charitable Foundation. Welcome to my channel, Tuning a Fragile Mind. I'm here today to talk about a very serious type of a mental disorder called personality disorder. People who are suffering from personality disorder have a very typical rigid way of unhealthy thinking, behaving and functioning. When you look at them, you can really not identify that they have such a problem because they talk to you so sweetly, they're very nice to you, but at the same time, they are extremely manipulative. These people normally deviate from the societal norms. And when you closely look at them and try to identify what the reason could be, you could find various reasons. Sometimes it could be genetic, it could be because of the environment, or it could be because of childhood trauma. Most of these people suffer from this kind of a disorder because of the childhood traumas that they have gone through. It is not easy to treat a person with a personality disorder because it's a very serious type of a mental disorder. The way a normal person perceives is totally different from what a person with a personality disorder perceives. The way they conceptualize things is also very, very different. These people, normally are diagnosed when they come to the clinic with different other problems like, say, BPD, a manic episode, or because of depression, or some people come with anxiety or OCD. And along with that, they could also have personality disorder. It is not required that a person suffering from BPD or anxiety or OCD should have this, no. But a person could have it also. So it could be a dual diagnosis. So when these people have to be spoken to, for many, many sessions, it's only talk therapy which is going to help control a personality disorder. First of all, building a rapport with these people is extremely difficult because they may talk to you in a different way, they may try to manipulate in a different way. They try to provoke you, they try to provoke a therapist, and they try to add so many things to the problem, and you may feel that, oh, this person might have suffered from this. No, not required, not necessary at all. These people can easily get into habits of stealing and lying. That's why I said these people are highly manipulative. And they don't bother at all even if they deviate from the societal norms. They don't believe in rules and regulations. They only try to point out fingers at the others and say that, see, this person is doing this. But they do not understand what they are trying to do. These people normally have problems with regard to relationships. They cannot consistently stay in a marriage. They have problems in school. They have problems in work. They suffer everywhere. And the whole thing is the way they think and the way they perceive is entirely different from what the normal human beings do. And this problem can emerge anytime during the teenage years or early adulthood. Coming to talk about the different types of personality disorders, the first thing would be the paranoid personality disorder, wherein these people are extremely paranoid about everything. You move an object from one place to the other, they may think that you're doing it purposely because they are there. If you talk to somebody in their presence, they may feel that you're talking something about them. So anything and everything is a suspicion for these people. It's very difficult to convince these people and help them with therapy. The next thing is the schizoid personality disorder. In schizoid personality disorder, you see the person sitting aloof, withdrawn behavior. They have their own pattern of thinking. They don't like to interact with anybody. So they're stuck to themselves. They do what they feel is correct. The next type is the schizotypal personality disorder, wherein they feel that they have that they have a capacity to control everyone. The way they think is entirely different. They have certain set norms and they try to go accordingly. They feel they can have a major influence on everybody around them. And simple, it doesn't work at all. The next type of personality disorder is the narcissistic personality disorder, wherein they think that there's nobody like them. They feel that they are really superior. And they behave in a different way. Sometimes it looks very odd because they always feel that they are superior, they can achieve anything because of their knowledge and what they have acquired. In another type of personality disorder, what we label it as histrionic personality disorder, we see people dramatizing a lot. They try to put forth their ideas in a very dramatic manner. They try to cry, they try to laugh, supposing they are in a crowd, they start screaming, they want everybody's attention. So they feel that they can get their importance by exhibiting such a behavior. So it is quite embarrassing for the people around them because these people, they lose their inhibitions. They behave in a very odd manner. Dramatizing is one thing, their mood shifts is another thing. They try to cry, they try to laugh, they try to scream just to gain attention. You must have come across a few people like this in your own lives. There are other personality disorders where one thing that I can think of is avoidant personality disorder. In avoidant personality disorder, you feel that the patient tries to avoid interacting with others. The patient tries to remain aloof. The patient feels that, okay, I may not be the right person to, interact. So let me avoid a crowd. Let me avoid the company of others. And he or she tries to isolate. Whatever may be the case, these types of personality disorders need therapy. Even a schizophrenic patient, you can bring a schizophrenic patient to a level of functionality and compliance to medication and treatment, but it's very, very difficult to help personality disorders. Many a times no medicine works. Nothing works at times. The therapist, goes crazy because he cannot even try to help such a case. They're a problem in their families. Families cannot help them. They try to steal, they try to tell lies, they knock off things, and they try to convince people that they haven't done anything. They know how to blame another person sitting in front of him or her. So especially in cases where there's a dual diagnosis, you can, supposing he's a BPD with a personality disorder, you can help treat a BPD case. That part of a person you can really help. But this personality disorder takes a long while. Only talk therapy helps. There is another very interesting case which we categorize under the borderline personality disorder. These people are extremely dangerous. They try to harm themselves. They try to cut themselves. If you don't listen to them, if you go against what they say, they start screaming, they get very irritable, they try to self-harm, they try to cut themselves, they take a blade or any sharp thing. And many a times it so happens that these are the ones who really die because of certain things that they do, like cutting themselves. If they cut the major artery, it's going to be a very problematic situation. So they do not understand this. Many of them even take drugs. Many of them drink a lot of alcohol, and they're not in their true senses, and they try to behave in this odd manner. So many a times these borderline personality disorders are institutionalized because it's very, very difficult for people to manage them at home. You take them for n number of counseling sessions. You may help them to about 10 or 20%, but the remaining 80% is a problem. Because for anybody to identify that, yes, this is a personality disorder, it takes a while. Even a family member will not be able to identify this. Because sometimes it talks so sweetly to you. You won't even understand that there is something behind their sweetness. So, assuming you come across such cases, kindly take them to a therapist for help. These people who have learned to deviate from the societal norms are very difficult to handle because they don't believe in any rules, no regulations. They just follow what they want to do. They talk whatever comes their way. They're very manipulative. They tell lies, they steal, they're paranoid, they try to harm themselves, they try to harm others at times. So kindly identify such, if at all you identify such problems, take them to a therapist and try to help these people. Supposing they develop a real good rapport with the therapist, at least be happy that they will change to a great extent. So viewers, this is a very, very complicated part of the psychiatric disorders, namely the personality disorders. So in case you come across such people, kindly try to help them because we need to change the society to a better one. We need to make the whole world like a global village. So unless and until all of us put in a little bit of effort here and there to help such people, we cannot change the world. So viewers, I request all of you to kindly pay attention and learn something out of these videos and then identify such people and then try to seek help wherever it is necessary. Thank you so much for your patient hearing.